Welcome back to the Anesthesia Training Series. I'm Charlotte Marqui. I'm a board-certified veterinary anesthesiologist, and today I will be talking to you about advanced IV catheter placement and IV catheter troubleshooting. So there are tons of reasons in the hospital or on the clinic floor that we have a catheter placement that's not going so well. It was tricky to do, either the patient was tricky, or there's just some issues with getting the catheter into the vessel. So today I want to talk about some of the most common reasons that catheters can be difficult to place or difficult to maintain, some of the things we can do to get around those issues, and then a couple of my pro tips for easy catheter placement and some techniques that you can try at home. So let's talk about a couple of reasons why catheter placement can be kind of challenging. So there are many. I think one of the most obvious ones is a patient that is just having none of it, so a non-compliance. So if you have a very fearful, painful, aggressive patient, it's going to be difficult to handle them, and if they're not still relaxed and cooperative, you're not going to be able to find your vessel. It doesn't matter how good you are at placing catheters, it doesn't matter how quick you are. If the patient is not going to be cooperative, that's going to be kind of the end of that story. A repeat offender or a recut. So this is an animal that's been hospitalized recently or, has just been sent home. It had surgery somewhere else. Maybe it came to you for a second opinion. These animals have usually had multiple IV catheters, maybe central lines. Maybe some of their tissue is scarred or they have bruising or phlebitis. These guys can be really tricky to find normal anatomy, normal vessels, and then let alone for the vessels to kind of stay patent and stay healthy during their time in the hospital. Metabolic diseases. So lots of animals, as they get older, they get sick. So there's many reasons that could make our organs, our vessels, our skin change in appearance and function. So for example, dogs with Cushing's disease, they have very thin, fragile skin. Old cats tend to have very thin, fragile skin as well. There are also some disorders where skin can be calcified and also where it can be very elastic and fragile. So these are all things that we need to think about because those patients maybe require small catheters, maybe they require just going to someone who's very experienced right away instead of kind of working your way up, the ladder. Chemotherapy patients. So this is kind of going along with recuts or repeat offenders. So these are dogs or cats that have had injectable chemotherapy through a catheter. That usually means they're going in every week or two to get IV catheters. What usually happens in this situation is that instead of you seeing just one vessel down, the front of the leg, the cephalic, these dogs and cats will pop up tiny little vessels, accessory, kind of all around. And that can make seeing the normal vessel very difficult. And because their skin is scarred, it makes passing the catheter very tricky. And then a couple of things that have to do with your technique. So sometimes it's about the animal and sometimes it's about you and sometimes it's just bad luck, right? But things that have to do with us, which make catheter placement difficult: bad scrubbing, bad taping, bad equipment, or T-ports. So if you try to secure a catheter to skin that is not clean, the catheter is not going to stay in place. If you use a cheap brand of tape or tape that is not very sticky, so that tape that's kind of like shiny on the top but sticky on the bottom, that doesn't usually work on animals, but it works great on people who don't have haired skin. Bad T-ports. So if you have slip tips, no matter how you tape them, we cannot guarantee that they won't fall out. By their very nature, lure locks are going to be more secure. So that does definitely have a huge impact on the security. Skill and expertise level. Now, sometimes you're going to need someone who's very experienced to get this catheter in at all, and sometimes it's going to be easy enough for anyone to do. That really depends on multiple factors, but certainly that is a thing that takes part. So now I want to talk to you about a couple of specific problems that I see with catheters and what are the most common reasons that they happen and some things that you can do that are easy enough to fix them. Now, naturally, we can't prevent every bad thing from happening, but if you have an idea of how to mitigate risk, maybe the next time you have that situation, you at least have that information and can say, okay, got something in the toolbox for this. So poor patient compliance. So this is your dog or cat. It is fearful, painful, aggressive. It does not want to have its legs extended. It is not willing to have you tape in the catheter. Maybe you've just fed the catheter and the animal pulls its leg away and is lost. So in those situations, we need better handling. So you can try with physical restraint. You can try applying a muzzle, maybe getting a second person to be a butt stop behind your big dog or behind your cat. A burrito helps a lot of cats and small dogs feel better, so that's certainly something you can try. But if those things aren't working and it is an emergent situation, do not be afraid of injectable or oral sedation. If you have an animal that doesn't want to cooperate and you need a catheter for fluids, drugs, life-saving medications, it would just be much better to sedate them and get on with your way. Because if the animal is relaxed, it will tolerate you doing all of those things. So patient noncompliance, we have two big ways we can go there: physical restraint and chemical restraint. Can't feed the catheter is one of the problems we see. So like burring or the catheter won't feed. So burring usually means that the catheter has sheared off of the stylet. So usually what you'll see is that the catheter white portion has kind of sheared away. Maybe it's like torn off. And usually what this feels like is that it feels very gritty underneath the skin of the dog or a cat. And usually what happens is that you'll feel it kind of get gritty. You'll be like, oh, it burred. And then the area starts blowing or developing a little hematoma there. So the most common reason that catheters burr, if you enter not at a steep angle. So you should be entering the skin at like a 45-degree angle at least to get into the vessel. That way you go right through and then you can level out. Now, if you go level with the vessel, what happens is that instead of going through the skin, you're going more just into the skin here. You're just passing more and more into it. And what happens is that that put a lot of force on the catheter and then it shears or burrs. Sometimes if you're using a very long IV catheter, this can also happen, and that is just because there is more space for that to happen compared to a short one. So you can always try a shorter IV catheter if you felt like you couldn't feed the long one. Maybe you can feed the short one and see if that's a little bit better. A dirty leg or like oily hair coat, like scurfy too, like if they're flaky, that can also be a big thing. So if animals have like very tough skin, oily or dirty skin, if they're intact, usually catheters will burr or they won't feed. And in those situations, you can re-clean the leg the best you can, but if you have an animal with very like thick, oily, just kind of tenacious skin that keeps burring catheters, I would needle nick them. So take like a 20 gauge or an 18 gauge needle and don't saw through the skin, but just feel where you would maybe want to put your catheter in for a puncture. Just make like a tiny little nick. By getting through the skin with your needle, you're going to decrease the work that you need to do with your catheter, and it's much less likely to shear. Can't see or can't feel the vessel. So most of the time when we're placing catheters, we're like, okay, I see the vessel, I can feel it, I'm going to put it there. Let's say the patient's been to the hospital a lot and had a lot of catheters. Maybe you can't identify normal anatomy, or maybe if it's a breed that has some congenital abnormalities or has abnormal legs, maybe the vessel is not going to look the same. In that situation, I would highly recommend going into the vessel based on your knowledge of anatomy. So if you know that the cephalic vein is above the carpus and it lies kind of on the top part of the leg, and it usually gets pulled out when you pull the animal's skin from medial to lateral at the elbow, then I would try to feel where it is and say, I know it should be here, I'm gonna go for it. A tourniquet can be really helpful in those scenarios. So lots of people think that tourniquets are just for big dogs, but if you have a dog where it has like lots of loose skin, or it has something like an abnormal leg, then using a tourniquet can just make your life easier, because usually the longer the tourniquet sits, the more easy the vessel gets to see. Get a grown up. So I know this sounds kind of dismissive, but it means exactly that. So even if you're really good at catheter placement, sometimes it's not going to be your day, and it's much better in that scenario to get the most experienced person in the hospital involved, whether that's a hospitalist, a specialist, another technician, an assistant that you work with. Like, get someone who you feel like is going to help you get the job done. There's absolutely no shame in asking for help in that situation. Ultrasound. So this one's a little bit fancy, but if you're kind of running out of options for catheter placement and you're like, I can't see them, I can't feel them, I really need a catheter, but I don't know what to do, finding the vessel with ultrasound is usually a good bet because you can use color flow Doppler and you can tell distinctly what is a vein and what is an artery, and you will be able to get that done. A cut down procedure. So I talked a little bit earlier about the needle nick. So that's where you take your 20 gauge needle and just do one of these to make your entry easier. But a cut down is a small surgical procedure where the doctor will take a little scalpel blade and just kind of cut over where the vessel should be. And this way we can pull apart the skin and see the vessel. So this is a great option for animals that are very debilitated, where we need an IV catheter fast, but maybe their system is very collapsed. Maybe they've had lots of catheters before. This is a great option if you need a catheter and you need it right now. So those are them. The vessels keep blowing. So what I mean when I say that is that they are developing like a bleb or like a little puffy area or a hematoma. And usually this happens when we have either gone through the vessel with the catheter, maybe the animal pulled the catheter a bit out and it was kind of working, but maybe we got some medications and fluids around that area. So now what's happening is that as we try to go back to repair that catheter and replace it, is that because the vessel's kind of leaky from trauma, from the dog, is that it keeps blowing. And this can be really frustrating because what this means is that we're not delivering medications into the dog or cat. So my best advice for this is to kind of try to prevent it before it starts, which is tough if you've already gotten too late in the process, but start distally and go proximally as you get more advanced. So if you think about the dog leg, if they have like their paw, their antebrachium, and then their elbow, what I would recommend is starting closer to the bottom of the leg, near the accessory or the bottom of the cephalic, and working your way up. Because that way, if for some reason the vessel down here is blown or it's damaged, you can just work your way up and the drugs are still going to pass easily past that point. It's not like if you start up here, if you start really high, and then this blows, and you decide to go down here. Maybe it flushes down here, the catheter, but if the vessel's leaky up here, you could be leaking like drugs, fluids, chemotherapy, just into that space there. And that's gonna be, at the very least, uncomfortable for the dog or cat, and at the very most, that can be really damaging to tissues. So start low and then work your way up. Use a small IV catheter. So if you have a patient where the vessels are blowing, maybe the animal has a metabolic disease, the skin is fragile, try to use a smaller catheter because I usually feel like they get into the smaller vessels a bit better, and when there is a hematoma, it's less profound than if you took like a short 18 catheter and went like hunting for the vein. Compression or vet wrap, so not just if there's a hematoma, but like if you feel that the animal's skin is very fragile, the vessels are very prone to blowing, then what I would recommend is that after you have placed your catheter, maybe put a gauze square underneath the catheter to pad it and then cover it with vet wrap. Not only does the vet wrap help keep the tape straight and the gauze underneath it, but it helps to waterproof it. And it may just apply enough gentle pressure to prevent some of that catheter shifting, which can also make the skin bruised, maybe make the vessel blow as well. Recheck blood work. So I know that sounds kind of silly, we're placing catheters to, deliver drugs and medications, not necessarily to pull blood. But if you have an animal where you feel like every time you touch it, it bleeds, it bruises, the vessels just do not cooperate. Maybe this is an animal that has a bleeding disorder, or maybe this animal has no platelets, or the platelets don't work, like in some Doberman dogs that have platelet problems. So if you get to that point and the dog has other signs of blood loss or impairment, it would be a good idea to check blood work just to make sure that it's not you, it's the dog or the cat. Consider a central line or a PICC line. So if you think that all of the peripheral vessels are going to be too tough to hit or they're too fragile, I would strongly recommend placing something like a jug cath. Because if you just keep blowing all the legs, you're going to kind of run out of options fast. And maybe it's just your best bet to go for something like an indwelling PICC line or a jug cath. That way it's like sutured in, it's bandaged, you have a much more secure way to get blood and sampling. it's going to be there for you for a good time and a long time. Okay, last major problem that I see on the floor, the IV catheter keeps getting pulled out or it keeps falling out. So there are a couple reasons this usually happens. So if the animal is very like bouncy, maybe it wants to like sit down in the kennel a lot and it has a back leg catheter, definitely that can be a factor. If you have an animal that is just like going stir crazy, I would recommend oral or injectable sedation, just to, at the very least to protect the catheter, but also to make treatment of the dog in hospital much easier. Use a long IV catheter. So we talked about in an earlier lecture how we have catheters that are like 1 or 1.25 inch, and then we have things that are 1.8 or 2 inch. For animals where you think they're going to pull it out or it's at risk for falling out, I would recommend placing a long catheter because there's just more of it that has to come out before you have a failure. Reclean the leg. So one of the most common reasons catheters fall out is due to bad taping or because the leg is still dirty or greasy. So in that case, you need to re-scrub and you need to re-alcohol the leg, dry it off really well, and then go ahead and place your catheter back in the patient. Again, consider placing a PICC or a central line. So obviously this might be for patients that are more debilitated, where you need to give more medications, fluid treatments, things like that. But if you have a situation where the vessels just aren't holding up very well and catheters keep getting ripped out, place a jug cath, place an e-collar on that animal, give it some trazodone, be on your merry way. Okay, so the last thing I want to talk about are just a couple of my pro tips for tough sticks. So these are just like some general things that I do on the clinic floor, which I feel like helps me be successful place catheters. Even so, I'm not going to be successful 100% of the time. So, you know, I try always to incorporate other things like getting help, asking for advice. But these are just some things that I do. Obviously, this is going to depend on who you work with, where you work with, what your style is. But hopefully you find these helpful. So number one is make sure the patient is secured. So have someone who is really good at restraining dogs or cats. Like, don't get someone who just got like hired yesterday and doesn't know how to safely handle the aggressive dog. It's not that we don't want to teach everyone how to do that. We absolutely can, but we have to be safe for both the patient, the person, and the doctor. So whether that means physical restraint or whether that means using sedation, make sure that you have that and you are comfortable. Use quiet clippers. So you might say, like, why does the clipping have to do anything with this? Well, if you get a pair of quiet clippers, and you can get them on Amazon for not very much, the dog or cat is more likely to be compliant in letting you shave the leg. And if the dog or cat is not afraid of that, you're going to be able to shave the leg better, get the hair off the leg, clean the leg better, and then make the catheter more secure. If you have to do like a flimsy shave job because you have like rickety old clippers and the dog or cat says, absolutely not, that sounds really scary, then that might make securing your tape really difficult, and then your catheter falls out. So those are how those things are related in my eyes. Gently prep the skin and then dry it. So lots of people scrub the leg. Unless there is like blood or vomit in the leg, I don't feel that you have to do that. I feel that sometimes scrubbing can be very traumatic or irritating to the skin. And that's usually the thing where the dog or cat says, no, I do not like this. I'm not going to be compliant anymore. So you just have to wipe the skin and then make sure you dry it before you put your tape on. Because if you have wet skin, the tape is going to slide and then the catheter falls out. Frustrating for absolutely everyone. For animals that have tight or thick skin, this can be very difficult to place catheters in. So an animal with tight skin, this is an animal that doesn't have like a lot of wrinkles or extra skin. So I am talking about animals that are like Labradors, sometimes French bulldogs, hounds usually have tight skin, and their skin also tends to be very thick. So because the skin is not very mobile and it like kind of stays in place, what usually happens is that the catheter burrs going through the skin. This is also the case in animals that are intact. So they're not neutered, they're not spayed. That is the way their skin behaves. I would strongly recommend a needle nick in those patients. Again, not every dog or cat's gonna need that, but if you have an intact older male Labrador or like an older male pit bull that has really thick, tight skin, then I think using the needle nick can be very helpful in those scenarios. Animals with looser wrinkly skin, so I'm talking about things like English bulldogs, Shar-Peis, Chow Chows, Basset Hounds. They have all these like loose wrinkles that are going everywhere. Maybe you can't see the vessel very well. Maybe the wrinkles are like over where the vessel should be. In this situation, I would recommend using a tourniquet because the tourniquet over time is going to make the vessel more obvious. The other thing I would recommend is move the skin out of the way. So you're like, okay, how do I do that? So when you have an animal that's like a Basset Hound or an English Bulldog with like wrinkly skin in that elbow area, get someone not just to hold off the vessel, but to move that skin flap out of the way and kind of make the skin tight for you again. So that in combination with a tourniquet can be a really easy way to start seeing some of the normal anatomy on the foot. And then by using your anatomical landmarks, you can kind of pinpoint, okay, I see this cephalic or this is where it should be, I'm gonna give it a go. Tab your tape. So tabbing your tape is the practice where you take the end of your piece of tape and you fold it under so that most of it is sticky, but that last like centimeter or so is not. The reason I think this is important is because if you have to untape the catheter at a later point because it fell out for whatever reason, you have a chance of being able to save it. But if you didn't tab your tape and you have to like rip the tape out, as you rip that tape out, what's going to happen is that the catheter falls out. So if you had a tough stick, maybe you want to keep it in there, try to preserve that catheter as much as possible. So that's why I think that can be helpful. Alternating the taping direction. So the reason I think this is important is that if you have one piece of tape going left and one piece of tape going right, the net pull is in the center. If you have both pieces of tape that are getting flipped to the left of the leg, the net pull is to the left. So this isn't always a problem, but certainly in some dogs that have like angular limbs or in dogs that are like in hospital for days, what can end up happening is that the catheter gets distorted, it gets pulled, and then it becomes what we call positional. So like the animal has to straighten its leg or you have to straighten the catheter in order for it to work. So what I would suggest is put your first piece of tape on and maybe flip it to the left and put your second piece of tape on and flip it to the right. And then if you do something like a security or a so-called bra strap or vet wrap on top of your catheter, you can just alternate the direction and that way the catheter is firmly kind of seated in place. Invest in lure lock T-ports. So obviously I'm biased. I think these are probably the best way to secure your catheters. But because they have a screw cap, kind of like a jar on a lid on a jam jar, they're going to be much more secure than a slip tip, which is just like point B, point A, this goes here, and it just kind of is held in there by its shape, like a puzzle piece. The problem with slip tips is that even if you put on a so-called security strap or bra strap, you cannot guarantee that that catheter is not going to fall out. So not only is this frustrating, but it can make the catheter messy if there's like blood around it. The other thing is that we talked about if there's like blood or liquid or like prep solution under your tape is that it doesn't stick, and blood is like a great way to grow an infection. So I would strongly recommend getting lure locks. I just find them to be a lot more secure and they hold up well over several days of hospitalization. Get a grown-up. We talked about how funny this sounds, but it's totally true. Sometimes you're gonna try the very best you can. You've done like 2 pokes, 1 leg, or like you've gone to 2 legs and you're moving on to your third. If you've gone to like 2 legs of the dog or the cat and you haven't been successful, I would strongly recommend getting someone else. I do this somewhat routinely, so if one of my technicians was not successful with the catheter and then I try on the leg and need to move on to another one, I'm gonna be looking for a professional really quickly, just so that I get what I want done. The last thing I'll say when it comes to difficult catheter placement is that sometimes we've tried that maybe the patient is compliant, it has a lot of diseases, maybe many different people of different experience levels have tried and we just haven't been successful. That's okay. Sometimes the best thing to do is just put that activity to rest for a while and come back later. So this might mean try again in 20 minutes with sedation. It might mean trying an hour after general anesthesia. It might mean sending the patient home and taking them in for the procedure the other day, like another day. Now, if it's an emergency, we're gonna need to get creative about how we delay this. But if you have an elective case where you just haven't been successful at all, it's 100% okay to think about sending the patient home and just giving them a break. Especially if they have a lot of diseases and you want to give them medications or therapies, then maybe that's just the best next thing you can do for them. So in summary, there's many things jog and person related that can result in difficult catheter placement. Here's a list of some of the most common problems and a couple of their solutions. If you have a specific problem, just come and ask me or anyone you know. And then a couple of my pro tips for placing difficult catheters. And if you have any other questions, just let me know.